Hi, and welcome to Therapy Thursdays with Leta here on Reading is a Human Right podcast, brought to you this week by Sip and Sway, our inaugural fundraising event for Illumination Center for Dyslexia. Come on out to Castle Grove on April 26th. Tickets are just $50 for general admission or $100 for VIP. It's going to be a great night for a great cause. Find out more and grab your tickets at illuminationsdyslexia.com. And now, on to today's episode. Today, we're asking, when is therapy right for your child? If your child has recently been diagnosed with dyslexia, or if they're just struggling to learn how to read, what are your choices? How do you get help? And where do you start? I'm Leta, certified academic language therapist. That means I earned a master's degree in dyslexia therapy from Mississippi College, the first college in the nation for a master's in dyslexia therapy. And I've passed the national certification exam. Basically, I've been doing this work since God was a child, and I'm here to help you navigate these decisions. Maybe you're listening today because you just got a letter home from your child's school. In Mississippi, for example, that letter might say your child did not pass the dyslexia screener. You probably got it this spring if your child's in kindergarten, or this past fall if they're in first grade. In Mississippi, we have to screen our children 2 times. If you're outside Mississippi, check your state regulations. Not every state requires dyslexia screening, and not every state even has to report the results. But whether you got that letter or you're just now noticing that your child isn't picking up reading the way that they should, here's the bottom line: it's important to act. The earlier you intervene, the better the outcomes. Reading is not natural. Kids don't just pick it up on their own. Like we talked about last week, learning to read must be directly and explicitly taught. Phonics instruction, where students learn how the sounds and the letters are connect, is crucial. For students who are struggling, dyslexia may be the underlying cause. Let me be very clear: having dyslexia doesn't mean there's something wrong with your child. It means they need more explicit, structured literacy approaches to learning how to read. Dyslexia is a spectrum. Some kids need just a little more support, some kids need a lot more support. But the earlier we start giving them the right kind of help, the less intensive that help usually has to be later. So, what should you look for at school? If your child's classroom is using a structured literacy program, meaning there's a strong phonics curriculum built into their everyday teaching, that is a great start. If your child is struggling and the school is giving them tier 2 support, small group interventions, or even tier 3 support, more intensive supports, that's a good sign. Ask your child's teacher, what reading curriculum are they using? Is there a structured phonics curriculum? Are the interventions in place if kids fall behind? How are they tracking your child's progress? If your child is starting to catch up with this extra support and you're actively involved and staying informed, then that school based support may be all they need. But if they're still struggling, if the progress is slow, or if you're concerned that the school isn't giving enough help, that's when outside help might be needed. That's what we'll talk about next: how to choose the right therapy program, what it should look like. If you're not sure what they've been doing, or if you're not sure that the resources that they have are enough, then we're looking at maybe some dyslexia therapy. What you're asking for is explicit, structured, sequential instruction, usually delivered by someone trained to help kids with dyslexia learn to read, write, and spell. Here's what you should know. These programs are structured. That means they follow a logical sequence. They are explicit. They leave nothing to guessing. They are multisensory. They use visual, auditory, and kinesthetic pathways. And they are diagnostic. They adjust to your child based on your child's responses. Now, you might recognize some programs. Orton Gillingham is the word, right? Those are based on the old school grandparent structured literacy. Dr. Samuel Orton, Anna Gillingham. Those are the two people that developed this method. It's not really a program. It's a way of teaching that focuses on the individual needs of the students using explicit multisensory sequential instruction. Barton Reading is a very user-friendly program specifically designed for students with dyslexia. It is scripted. Tutors, parents can follow these step-by-step lessons. It's great for home-based tutoring. Wilson is a little more intensive. It was originally developed for older students who were not successful with traditional reading instruction. It's heavily phonics-based, and it's used widely in schools and private settings. And others, like alphabetic phonics, House, these are all based on that same method of Orton Gillingham. Here at Illuminations, we use a lot of these methods, these Orton Gillingham methods. In addition, we have House basic language skills and Lexercise, as well as 95 Rap. Each of these have different strengths depending on your child's age, needs, and setting. If you're looking for something you can do at home, or looking for something more intensive, or if you're looking for a therapist that's trained in Orton Gillingham, these are all customized to what your children need. Dyslexia therapy isn't about gimmicks. It's not about memorizing sight words. It's about rebuilding the foundation for reading the right way, sound by sound, word by word, pattern by pattern. It is never too late to start, but the earlier, the better. Let's go a little bit deeper into the certifications that you might be asking these tutors for and what the differences are between them. I want my child to get the right kind of help, but how do I know who's qualified? That's a great question. Whether you're choosing someone to deliver dyslexia therapy, it's really important to understand the difference between program certification and professional certification. So here's a quick breakdown. Someone who's certified in a program has completed the training specifically for that program. They've been taught how to deliver that program step by step. For example, Barton certification is excellent for delivering structured literacy, and it's program specific, meaning they're trained to deliver Barton, not necessarily trained to diagnose or individualize. IDA certification via SERI sets the professional standards for what dyslexia intervention should look like. SERI is the Center for Effective Reading Instruction. It's credentialing. People certified through SERI have passed the K-PERI exam, the Knowledge and Practice Examination for Effective Reading Instruction. They're not just trained in one program. They understand structured literacy principles deeply, and they can apply those principles across settings and students. ALTA certification, Certified Academic Language Therapists, are highly specialized. To become a CALT, you must complete a rigorous dyslexia therapy program, typically 2 years long, at least 720 supervised clinical therapy hours working with students under a mentor therapist. After that, you also pass a national exam. CALTs are trained not just in reading instruction, but in the full scope of dyslexia therapy, reading, writing, spelling, language intervention, and are often the highest trained in the field outside of clinical psychologists. To put it simply, a tutor that's certified in a program knows the program. A SERI certified practitioner knows the reading science and multiple approaches. And a CALT is clinically trained to treat dyslexia with a very deep and diagnostic process. One's not bad and the other good. It's about the level of training that your child needs. Some kids will thrive with a highly trained tutor. Other kids, especially kids with severe dyslexia or multiple learning needs, may benefit from a deeper clinical expertise. So ask questions. What's your certification? Are you certified by a program or professional organization? How much clinical practice have you had? How do you track and adjust instruction based on my child's progress? I hope this helps. Next week, we'll dig even deeper into what a great therapy session should look like and some warning signs to check out for if therapy's not meeting your needs. Thanks again for joining me today. And don't forget, support kids like yours by coming to Sip and Sway, April 26th. Tickets and info at illuminationsdyslexia.com.